Hello one and hello all. Today we shall be talking about the Prevnar 13 vaccine, or the pneumococcal 13 valent conjugate vaccine, and why you should take it. If you don't want to hear all the information about the bacteria or the vaccine, just go to the time that's shown on the screen now. You just go to the part where I just tell you how great this vaccine is and why you should use it. Anyways, first off, we should be talking about what disease this vaccine is for, and it's for pneumococcal infections. So, what are pneumococcal diseases? Well, pneumococcal diseases are serious diseases that are caused by the bacterium Streptococcus pneumonia, an airborne pathogen that is basically everywhere. And it usually starts to hurt you when you have a weakened immune system. Now, what kind of disease you get from Streptococcus pneumonia depends on where it infects you. If it infects your lungs, you'll get pneumonia. If it infects your blood, you get bacteremia, or it's on the screen. If it infects the tissue or fluid surrounding your brain or spinal cord, is meningitis. It could also go into the ear and cause sinus infections or middle ear infections. Now, why I call this a serious disease? Well, it's a pretty bad disease. In the US alone, there are 175,000 hospitalized cases of pneumococcal pneumonia, 34,500 cases of bacteremia, and at 2,200 cases of meningitis. And as also according to the National Foundation of Infectious Diseases, pneumococcal diseases results in about 4,800 deaths annually. Most of the deaths are from elderly patients and immunocompromised patients. And according to one source, there's about 60% mortality for elderly for bacteremia diseases, despite appropriate antimicrobial therapy and intensive medical care. Oof. So, what can protect you from these deadly pneumococcal diseases? Well, vaccines. There are two types of vaccines: the pneumococcal conjugate vaccine, the one that we're talking about in this video, and the pneumococcal polysaccharide vaccine. The difference between those two vaccines is that the pneumococcal conjugate vaccine, or the PCV13, is for an immunization against the 13 common Streptococcus pneumonia types that are known to cause the most common serious cases of diseases. And the pneumococcal polysaccharide vaccine, or the PPSV23, is for the 23 other strains that are known to cause serious cases, but aren't that common, and are usually for the more elderly people whose immune systems have gotten weaker over time. And the fun fact though, PPSV23 is also recommended for people who are chronic smokers, which causes your immune system to become weaker. So don't smoke. The PCV13 is recommended for all children under 2 years old to take, and everyone above 65 years old to take. So everyone's probably going to take this vaccine at least once in their lives. They're smart, twice if they're smarter. And both vaccines are also for people who have medical conditions that weaken their immune system, such as HIV/AIDS, missing spleen, heart conditions, sickle cell anemia, and cancer. However, it is not recommended for those who are severely sick to take the vaccine, as receiving the vaccine could just increase your reactions to the illness and cause adverse reactions. In the case for pregnant people, although there is no evidence of the vaccine actually harming the baby inside, and as a precaution, pregnant people should also not take the vaccine. And in the case of prematurely born babies, it's rarely, although it still happens, Prematurely born babies who have received the vaccine can develop apnea, which is basically that they stop breathing for short periods of time occasionally while they're sleeping. And as such, whether or not they take the vaccine, it depends on their current medical condition as well as the benefits and risks of taking the vaccine. So, how is the vaccine made? First off, what is the vaccine? The PCV13 vaccine is a sterile suspension of capsular antigens of 13 common Streptococcus pneumoniae types, each being linked to non-toxic diphtheria CRM197 protein. An antigen is a foreign molecule or substance that our white blood cells can recognize and use to determine what is a foreign pathogen or what is part of our cells. Basically, it's an identifying and hurting factor of the pathogens or bacteria that can hurt us. The capsule is basically an extra protective layer of a bacteria and is like an extra slimy layer above the cell membrane. So how are these proteins made? Well, each of the 13 strains are grown individually in a soy peptone broth, and those antigens are isolated from the cells and other cellular material via various means. And then these things are attached, chemically bound to the protein carriers of diphtheria or the CRM197 protein, which is also isolated and obtained in a similar fashion. Now, I know none of you guys are wondering this, but why they attach these antigens to the CRM197 protein is to help our T cells, a type of white blood cells that calls other blood cells in, to recognize and just use this antigen to help our long-term immune system function and thus allowing us to be immune to bacteria for much longer. It basically allows our T cells to do things to just use the long-term immune system instead of just attaching to a regular B cell, which just results in a regular immune response but less memory of the pathogen. You could look at this helpful diagram that's been on the screen for a while for assistance. So how is this vaccine introduced into people? Well, it's via intramuscular injections, or basically an injection into the muscle, of doses of 0.5 milliliters. In the case of infants, it's injected to the thigh. In the case for every other age, it is injected into the upper arm muscle, specifically the deltoid muscle. So what happens after that vaccine has been injected into you? Well, the antigens flow around the blood until they meet a type of white cell called the B cell, which then proceeds to integrate it or just take it into the cell and destroy it and break it apart. It then proceeds to just put out parts of those antigens on the surface of the cell, in simple terms. Now this is where the CRM197 protein carrier comes in handy, as that carrier protein makes it easier for it to process the antigen and break up into parts instead of completely destroying it. Now what happens after antigen parts are placed onto the surface of the cell is that a type of white blood cell called the helper T cell can then bind to that antigen fragment on the cell. When it does, it starts to produce a protein called the cytokines, which calls other white blood cells or B cells towards the area where these antigens are. And then these B cells will start to do various things, such as become plasma cells that are continuously produce the specific antibody for the antigen. To be specific, each type of B cell has a different receptor that's specific to a specific type of antigen, and thus it calls those specific B cells over, and those specific B cells will start producing antibodies. Either that or some B cells will just stay there and not turn into plasma cells and instead remain in the bloodstream as memory cells, which will allow fast response to future infections, thus improving our long-term immunity. This is beneficial because the helper T cells allows the calling in of more B cells, and thus will allow a higher level of immune response, and thus more memory B cells and more antibodies within the blood system. The good part is that your long-term immunity is developed. The bad part is you could possibly have side effects. That or you're actually allergic to another component in the vaccine, in which case your immune system will respond to that and will actually be harmful to you. So is this vaccine good for you? Yes, we should be taking it. Now, some people may complain about side effects. Maybe side effects are bad. Maybe they are like very common, but no, they're not. In a clinical study of this vaccine on children, toddlers, infants, and adults, when I say children, it's really just 5 to 17 years old, we've seen that side effects are seen in less than 5% of the test subjects. And even then, these side effects aren't that large. Some of them include irritability, injection site tenderness, decreased appetite, decreased sleep, increased sleep fever, injection site redness, and injection site swelling. If you want the full list of side effects and the percent of the people who actually got the side effects that have them, they are presented on the screen now. As you can see, there's a lot on adults. They're also pretty different. They're all mostly very inconsequential. Now, if someone wants to know some serious side effects, they'll but as the National Foundation of Infectious Diseases did say, this vaccine does not cause pneumonia. Now, for other evidence that shows that this vaccine is actually effective, there was this study done in 2015 by Dr. Bonten and others to test the efficacy of this vaccine against pneumococcal diseases. And the results are in this graph right here. As you can see in this graph, the left shows the number of cases of community-associated pneumonia. Center shows non-bacteremic and non-invasive community-associated pneumonia. And the right shows invasive pneumococcal diseases caused by stereotypes or types included in the vaccine. And these are comparing those who received the PCV13 and those who have received the placebo. And now these results show that over the 4 years, PCV13 was successful at reducing the number of community-associated pneumococcal infections by 45%, non-bacteremic and non-invasive community-associated pneumonia infections by 45%, and invasive pneumococcal disease infections by 75% in vaccinated individuals. The study was done by a random inoculation of either a PCV13 vaccine or placebo, after which they were monitored for at least up to 2 years, with healthcare centers monitoring pneumococcal bacteria infections by antigen detection assays from urine samples collected from the subjects. Another study by Moore and other scientists also showed that in the case of children aged from 2 to 59 months, the vaccine was efficiency of the vaccine to provide immunity was over 80% for all the types of streptococci that was in the vaccine. Basically, it works. A review study done by Clear C also showed that after the introduction of the conjugate vaccines PCV7 and PCV13, PCV7 basically being PCV13's predecessor, almost exactly the same, except it only against 7 serotypes instead of 13. PCV13 was made because increasing immunity to those 7 diseases caused 6 other serotypes to become more common. After those vaccines were introduced, you notice a considerable decrease in pneumococcal diseases caused by the serotypes in the vaccine. If you want the graph, here is a graph done from studies done by the CDC that shows that after the introduction of those 2 vaccines that the infection rates has significantly gone down. What kind of study they exactly did, I'm not sure, but it's from the CDC, so it should be fine. And I said before, PCV13 is basically PCV7, except it covers 6 more serotypes. So as you can see, these vaccines are useful. They cause a decrease in the rate of pneumococcal diseases, thus saving a lot of lives. And yours too, because you probably took it when you were a child. Well, there's one more thing to do, and it's to show all these resources. Look out, it's very fast. That's a lot of resources. So the acknowledgements. I know they're usually written, but I'm going to say them here. I made this video through all these troubles and turbulations and crashing Premiere Pros. I also did some of the research. John Locke also did some research. He found most of the research articles I used in here. He also found a lot more. And he also obtained much of the pictures that are used, mainly the diagrams. I found most of the physical pictures and cartoons myself.